Hey guys, welcome back to another edition of the Watchmen Brief. Josh Sluder of Altrua HealthShare is going to join us in just a moment. But before he does, exciting news and announcement. All things Watchmen Action can be found at watchmenaction.org. I think you already know that, but we're super excited to share that the next phase of Watchmen Action as a nonprofit ministry is on its way. We're going to expand our Watchmen Action clubs and our training program to get as many of you ready to advocate and then ready to lead and train others that are ready to advocate. That is in process right now. We will have special announcements and additional information for you here shortly. The other exciting announcement for Juliana and I, if you go to wearethewatchmen.org, that's wearethewatchmen.org, guess what you're going to see? All the information and background that you want on Juliana and I, every time that we're on in the media, the exciting announcement about the 24/7 Watchmen Action Network in partnership with our friends at Q Broadcast and also broadcasting live on Roku TV, Tubi TV, and Pluto TV. You can now find all of that information in addition to our great sponsors like Altrua HealthShare, all in one place. Just go to wearethewatchmen.org. That's wearethewatchmen.org. Also, make sure to check out our publications, Sherlock Exposes / Rip from the Headlines, and We Are the Watchmen Weekly. Now, you can find that information at wearethewatchmen.org as well. It'll take you straight to the newsletters, and you can get all the information that you need. All right, when we come back, Josh Sluder from Altrua HealthShare is going to join us to talk about what's going on with healthcare and HealthShare and all the great stuff that Altrua has to offer. You're watching the Watchmen Brief. Stay tuned.
He had a good business, solid product, good people. He just couldn't figure out why growth had stalled. Sherlock found the buyers he didn't know were looking. Now he knows exactly where to go next. Learn more at investinanswers.com.
She sat in the driveway and thought about the drive. 45 minutes each way. Half a day gone. Then she remembered there was another way. Board-certified provider, same day, right there in the driveway. She never started the engine. 360phi.com.
All right, guys, welcome back to the Watchmen Brief. This is R.C. Williams, excited at this time to bring up our good friend, Josh Sluder from Altrua HealthShare. Sir, welcome to the Watchmen Brief.
Hey, RC, thanks a lot for having me. Looking forward to our conversation today.
Yeah, Josh, it's great to have you on. You know, we were talking off the air before we came on about how exciting it's been for us to have Altrua as a partner and how much we've learned and even talking to people about what Altrua HealthShare does. So why don't we start here? Let's give people a baseline understanding of the differences between traditional healthcare and what Altrua HealthShare does.
Yes, sir. So, first and foremost, Altrua HealthShare is a faith-based healthcare sharing ministry. There's a number of different things that set us apart. But whenever I'm speaking about Altrua to, the general public, one of the things that I really like to start on is cost. So, in comparison to your commercial insurance companies, a lot of the BUCAs, the health share in general, but specifically Altrua HealthShare in this situation, our contribution amounts and the cost to the individual or to the family is significantly lower than that of what they would experience in the marketplace with another traditional healthcare solution. There's a lot of other things that I can speak to. I'll touch real quick and then we can deep dive any of them if you want. Altrua HealthShare has an open network for members to be able to go to any provider that they want to. But then we also have an in-network option through a relationship that we've created with the First Health Network, just because there are consumers out there that are really used to having access to their providers and facilities through a network, because a lot of them are coming out of that traditional insurance space. And so as they're going through their healthcare journey and as they're stepping into HealthShare, there are some things that we do want to make similar for them, just so that way they can navigate it really quickly. But, for me, whenever I look at what differentiates us from not just those in the market, but also compared to traditional insurance, is we're much more affordable. Our discounts are significantly better. Our member experience is better. Whenever you're a consumer of a HealthShare, specifically Altrua, you're not just another number, you're a part of our family. And you get to participate in a membership that really is in alignment with the values that most of our consumers, if not every single, hopefully all of our consumers have, which is pro-life, making sure that the members are at the middle of the membership and not the shareholders. HealthShare kicks out the shareholders and doesn't distribute profits to anybody. Instead, HealthShare goes to sharing on the medical needs that the members generate. And Altrua is an amazing product simply because they are technologically advanced and continuing to work towards making the member experience better. And we do a great job listening to the voice of our members in order to do so.
So Josh, this is great. And you mentioned something during your answer that I want to continue on because I think it's important. So you mentioned that you've partnered up for those who are working to make the transition from traditional healthcare, whether it's Big Blue. I won't go into a number of them because I don't think we need to. But, they're making the transition for maybe a traditional healthcare provider. And they want some assurances, maybe if they can keep their current care provider, whatever the case may be. Or in my instance, coming from California, a large firm out there was pretty much an all-in-one. Like you could get everything you ever wanted done with your health, eye, dental, all of that stuff in one place, in one shot. So for someone who has been or become accustomed to that system, how do we bridge the gap from there to what Altrua will provide?
Yeah, it's a great question, and it's one that we get frequently. And one of the things that we aim to do, and we do our best to be consistent with at Altrua, is making sure that the members have us as their advocate every step of the way. So whenever you have people coming out of traditional insurance, like you had referenced a moment ago, they're not alone. They have other members they can talk to. They've got our member services team that they can talk to, and Altrua puts out a lot of educational material for the members so that way they know how to interact with their providers, how to work with the Altrua HealthShare membership opposed to what they're coming out of. A lot of people even come to us having never had any sort of healthcare coverage before. And so what we try to do is really communicate at a level that the members can understand, and that's really practical. As we know, there's a lot of products that we're consumers of, and sometimes whenever we need help, they're talking up here whenever we're like, hey, we don't understand your processes, the inner workings. Like, I'm a consumer, I need you to communicate to me from my level. And that's what Altrua has really done. So whenever somebody is making the transition over, I always encourage them, utilize our member services, contact Altrua directly so that way we can walk through you with any situation that you or your family is going through. But to the other point, we do our best to make sure that, yes, we're aiming to change healthcare, but we also want to be able to have a process that members and consumers are already semi-accustomed to, with some differences in there, because every member of Altrua HealthShare is not insured. Since Altrua is not insurance, they're a self-pay patient, and that really does open up much more for us to do on the member's behalf, and then even the member on their own behalf. And so what we've done is really created a comprehensive process that allows the consumer to walk through their healthcare path without having a bunch of blind spots.
So Josh, thank you for sharing that. One of the things that we see in the news a lot, whether it's X or whatever news feed you're on, social media wise, is this trend of people having traditional healthcare, health insurance. They go for an appointment or to pick up a prescription, or they have a service done. They look at the bill and the number's just like ridiculously astronomical. And then they ask the question, so if I pay cash for this, what's the price? And it goes down dramatically. So based on what you've just shared with me, would Altrua be in a position to maybe be an advocate for us if we're trying to discuss the cash only pricing, because it's health share versus healthcare? I'm curious as to how that would work.
Yes, sir, absolutely. And one of the ways that we do that, and there are a number of ways that we do, but our frontline team, which is our concierge team, is really focused on those situations, so that if a member is at a provider or facility location, before their service or at the time of service, or even if they're dealing with a situation after the time of service, our concierge team is there to advocate on that member's behalf, be the front lines, and they're there to deal directly with the provider on the member's behalf, so that way we can keep our members in the fight of life doing what it is that they need to, whether it be doing their job, providing for their family, whether it be showing up for their kids in whatever way that they need to, or the number of other things that life throws at us. Our job at Altrua is to make sure that we can go advocate on behalf of the members and keep them doing what their normal flow is with life. One of the things that Altrua really does pride itself in is eliminating surprise billing, or what the general consumer would know as balance billing. And through the ability of negotiating on behalf of our members who are self-pay patients, we're able to average a significant discount all the way up to 100% sometimes, but with an average of around 65 to 73%. And so by leveraging our provider relationships, creating new provider relationships, and then ensuring that the members have a great experience and can continue going back to those providers, we're able to make sure that if a situation happens, it's not one that continues to happen and repeats. So typically if a situation arises, we like it to be a one-time resolution, so that way the member's care path moving forward can be seamless.
So Josh, thank you for that. One of the things that we encounter, we teach senior citizens basically to be tech savvy as part of our ministry. And a question that's come up on something like this is you have people who are older and obviously their health needs are increased and they are more concerned about the security that comes with being able to get seen and stuff like that. So in a world where maybe they're dealing with Medicare or they've got some type of other policy, but they're like, you know what? I'm still kind of paying through the nose here, and I'd like some help or to understand alternatives. How would that work?
It's really a big thing that we're dealing with at Altrua right now is making sure that those members that have been on the membership for a significant amount of time and then they become eligible for a program like Medicare. We want to make sure, hey, yes, go over to Medicare, but if there's anything that Altrua HealthShare can do for you through membership or through advocacy, we definitely want to be, for lack of better terms, that gap fill solution for them. A lot of the senior citizens that are out there and just people who have healthcare plans in general, there's a lot of gaps there. And because Altrua does such a great job of covering our members and the membership 360 degrees, there are situations and times there where if somebody does have a Medicare product or if somebody has another, minimum essential product, Altrua can come alongside that individual. They can be on the membership as well, and they can leverage the share power as well as the membership in those situations where that other product, whether it be Medicare or another, is not able to have their back. Because as we know, those plans are limited, and Altrua would be secondary in that situation. But if a member has something like a Medicare or another product, and then they have a medical need that comes through that may not be eligible for that other product, well, then Altrua HealthShare, of course, is going to apply the membership guidelines, but then we'll share appropriately. So it's a great solution for people that are on Medicare and other products. It's also a great solution for somebody that wants to use Altrua HealthShare as their only healthcare solution.
So Josh, for those who prefer alternative care, which is a big thing right now, right? Because there's the sick care system and then there's actually healthy care or let's say preventative maintenance or stuff like that. How does that work in the Altrua universe?
It's a great thing to know that Altrua has created a membership where individuals and family members who are a part of Altrua can really be in the healthcare path that they choose is best for their family. And like I tell people, not all health shares are created equal. They're all a little bit different. So are all the health share members. And so if you look at the Altrua HealthShare membership, we've got members all around the country at all different stages in their life. And some have had sicknesses before and some haven't. But one of the common things that we see is there is in every demographic and every location, a set of individuals or families that really do want to follow the care path that you were describing a moment ago, whenever it comes to healthy living, whenever it comes to, naturopathic, homeopathic sort of care. And they're really doing their best to be proactive. And so as their health share partner, we want to join next to them and make sure that as they're being proactive, we're taking a proactive approach with them as well. So we do encourage individuals and families to make sure that if there's a specific care path that they want to follow, a specific type of provider that they want to be seen at, we're going to make sure that the membership that we recommend for them to be on is going to be one that supports that. And if somebody is on the membership, and let's say that they're on our Diamond membership and their care path changes because of an event that happens, we've got other memberships as well as the MyShare product that allows us to customize a membership plan for that individual or for that family that really does support the care path that they're going forth and for their family.
Most of us have something we have been quietly managing, hoping it resolves, telling ourselves we will deal with it next week. Board-certified providers are available today from your home, private, thorough, and licensed in your state. Stop putting it off. 360phi.com. Most growing businesses are making seven-figure decisions on gut feel and assumptions. The biggest companies in the world don't operate that way. Neither should you. Sherlock gives you market intelligence they pay six figures for. We find your buyers before your competitors do. Visit investinanswers.com to learn more.
So Josh, as we go through this and as Juliana and I answer questions with people when they see that you guys are a supporter of what we do with Watchmen Action and with the show, it is good to hear all of these things and to have some context. The other thing that I'm excited about is I think we're seeing a shift. There's like this re-education process for so many people, because now I feel like the rubber has kind of met the road, for lack of a better term, with traditional healthcare, and people are kind of getting that nasty surprise that's inside when it kind of gets out of control. So on that note, I do want to transition and talk a bit more about Altrua HealthShare as an organization. Now, you guys have been around for a while, and you and your dad and your family have been in and around the business for many years. Give us some background on you guys and how we ended up at Altrua being a leader in the health share space.
Yes, sir. So, Altrua is a fun story to tell. Altrua has been around and sharing in members' medical needs for about 30 years now, and we're definitely not stopping. We're only increasing the reach that we have. And one of the things that I get most excited about whenever I talk about Altrua HealthShare is not necessarily just the HealthShare product that Altrua has, but it's the ministry component. And so whenever you ask about our history and how we came to be, my father, Randy Sluder, was negotiating on medical bills for some other health shares. And whenever he was doing that, he really started increasing their member experience and obtaining great discounts. And whenever Altrua came to him to see if he would want to participate in a way of leadership with their organization, he was able to step into that role and then deploy what he had learned through medical bill negotiations across the membership. And so in doing that, it really comes from a ministerial heart that my dad and my late mother had, which was not just to share in individuals and families' medical needs, and not just to discount them as well, but to have an impact on the community that they were in and also the community that their members are in. So Altrua does have Altrua Ministries, which is really the foundation and what everything with the health share is built off of. So we go in as Altrua Ministries, and we aim to share in ineligible medical needs on behalf of members that are struggling through hard situations. We go in after times of trauma and rebuild homes, like after the Texas floods. We go out on rescue efforts. There's a number of other nonprofits and ministries that we do donate to because we feel like their missions are in alignment with ours, which are, things like revision of cleft palates that children are born with, helping to feed those that don't have food, helping to provide education for those that need education, and then same thing with clothes. We do a lot of clothes donations and working with ministries that are really having high impact in their communities. With Altrua being a 30-year health share, there's been a whole lot that we've been through different elections, through the COVID pandemic, through times of economic, downswings and upturns. And Altrua has always done a great job of being the tip of the spear for their membership and the members that are coming on to make sure that no matter what's going on in the country, no matter what's going on in the communities, Altrua is a steady voice and a steady and consistent solution for them, no matter what it is that they're navigating. So whenever I think about the history of Altrua, it's been one of perseverance, it's been one of overcoming, and it's been one of scaling, so that way we can continue being a relevant solution for those that are consumers of the product, and we're going to continue to do so. So at the heart of it, Altrua HealthShare is a ministry that aims to bear each other's burdens so that we can fulfill the law of Christ. And the way that the HealthShare does that is through sharing in each other's medical needs. And the way that the ministry does that is by being the hands and feet of Jesus Christ and getting out there in the communities and getting dirty and serving those that we're able to.
Josh, that story, I think, really puts a pin in the difference between big health and the business that they're in, and the ministry work and the helping of people that you guys do, which is why we're excited with Watchmen Action and the Watchmen Brief to be partnered with you. So guys, Josh, before I let you go, I want to make sure that people know how to get the information, and just a kind of a shameless plug on our site here. If you go to altruahealth.org/Watchmen, MEN, it's running along the bottom of your screen, altruahealth.org/Watchmen. You can get more information. You can actually get signed up for your own health share plan. And if you use the code FREEDOM100, you'll get an additional discount. So altruahealth.org/Watchmen, make sure to use the promo code FREEDOM100. So Josh, before we go, it's been a blessing and a pleasure to have you on. Parting words, anything else that people need to know before we jump off?
Support the Watchmen, support Altrua HealthShare. Each one of these organizations are really deep into the fight on behalf of those that have the beliefs that we do. And with everything that seems to be closing in on us right now, as a nation and as believers, I think it's important that we all continue to band together. So I just encourage everybody to support these two organizations. Come and visit Altrua HealthShare. There is a plan on there for you that'll work. I encourage you to check out MyShare. You can build your own customized membership plan for you and your family that's going to evolve with you throughout the seasons and situations you go through in your life. And we look forward as Altrua HealthShare to continue into partnering with the Watchmen and RC.
Amen. Josh Sluder, Altrua HealthShare, thank you for joining us, sir.
Thank you. Have a great day.
You too, guys. Thank you for joining us on the Watchmen Brief. For all things Watchmen Action, go to watchmenaction.org. Until next time, so long.